pretty much open communication that way. But if there was some other like major issue going on, that I was like, there's always this happening, and I can't ever seem to communicate this. I just need to tell you that this is happening. This nurse is always on her cell phone while she's here, and I feel like she's not even listening to what Annalise needs, that kind of thing. Okay. So it would kind of go both ways. And as I said earlier, too, the nursing agencies would specifically have meetings with me, about once a month or once every 2 months, just depending on how the agency works. Each agency seemed to have a little different protocol on that. Mm-hmm. And likewise, the CAPC agency would have, I guess it was every 3-month meetings, 6-month meetings, and annual meetings with us. Okay. Because every year we had to be reapproved for her services. Okay. Via CAPC, so that she could be approved for hours, and they would assign a budget to her of how many hours that she could benefit from, that kind of thing. So we would just communicate back, and we would try to stay in good communication so that with any one of those groups, so that they were aware of her full need and knowing what was going on, mm-hmm. so that services could continue, basically, okay. and continue well, so that things were always operating as best as possible, in our house.
Okay. How have the types and frequency of home health care that your family received changed over time?
Well, I guess we did kind of cover that a little bit, but just to kind of focus on that or surmise that a little bit. It started out kind of briefly, or more mildly, I guess, with just receiving the formula that she received. Then she, because she needed a special kind of formula, at least that's what they were thinking at the time. She wasn't tolerating her feeding or gaining weight very well. And then at 1 year of age, it was clear that she needed a feeding tube. So then we were in need of supplies and a feeding pump and that sort of thing. So we, were receiving more medical supplies, that sort of thing for her care. And then as she would develop colds and would have to frequently go into the hospital because she wasn't breathing well, that sort of thing. Then she was prescribed oxygen to have at home. So then we were able to have oxygen at home, but then there were more supplies involved with that: oxygen tanks, oxygen concentrators, a pulse ox meter, or oxygen meter, oximeter, whatever you want to call it. And all the supplies that go along with that, and monitoring that. So her needs became greater over time. And then, just as well, realizing that, she was not going to walk. She was needing a wheelchair for out and about in the community, and then she was needing an activity chair in home, just to be able to more easily maneuver in home. Do some different types of an activity chair just allows them to be able to have some greater access in the home and be able to participate at a lower level to the floor, so she could play with her sibling, or up more at a counter level, whereas a wheelchair is kind of just stationary one level. She needed a bath chair in the home, to be able to safely take a bath. She needed a stander eventually over time because that was helping with motility and with her growth and all that kind of stuff. So things kind of just picked up and ramped up over time, and it was clear that she needed more and more and greater nursing help. So whereas we started out with just maybe 20 hours a week of CNA level care, which changed to PNA level care, which then changed to we really need someone who can come overnight. So then we were approved for skilled nursing overnight, so that they could determine to give medication and give her medicines in the morning and the evening, or throughout the night, I should say, and change out formula and be able to intervene if she was having problems in the night, so that we could get rest ourselves and not be up 8 times a night, which was happening before we had that overnight care, and that went on for about 3 years. And then it was like, oh, well, if we ever want to do anything with our other child, we're going to need someone who can be here to administer medication and be able to do other things with her if she were to be, if she were to be choking, if she were to need oxygen. We need a nurse who can determine those things, which a CNA cannot. So we need more hours in the day as well. So from when she gets home from school until her overnight nurse shift comes. So it increased and increased and increased over time as far as all of those needs go.
Okay. So a follow-up question to that was what factors contributed to those changes in care, and it just sounds like it was her needs. Were there any other factors that contributed to changes in care?
You're right that it really was mostly based on her needs. However, her needs were always there, and it kind of just became, to some extent, recognition that those needs were so great, and then her CAPC agency realizing that she was in greater need of care, or more care. Also, even communication with her doctors writing letters for her CAPC approval each year to be able to say she is in need of these sorts of things. We recommend, this or that type of care. She does need overnight care. I actually have a chronic medical condition myself, so lack of rest is a huge challenge for me as well, and then my ability to be able to care for Annalise. So I actually got the note as well. My doctor actually even wrote a note for Annalise's care to say, Annalise needs this care so that my patient, her mom, can also, get rest and, be able so that her care is best managed.
Okay.
So there were some things that also occurred like that. And so it was really just that ongoing recognition, it looks like there needs to be more care. It looks like there needs to be more care. Okay. And it was, asking and just going out and just having, especially our CAPC management agency and case manager being willing just to ask those questions to the state to say, or just being willing to go out and request those additional services, even though they would say so many times that, we've never had this approved before, but we'll go out and ask anyway. It doesn't hurt to ask is what became our mantra. Just go ahead and ask because you never know. And then we ended up getting more and more approval, which was such a blessing as well.
Okay. What about the quality? How did the quality of home health care that your family received changed over time?
I will say that it definitely increased, hugely increased, once we were transitioned from PNA level care to skilled nursing care. Okay. So that was a really, really big piece for us. And I would just say, Annalise, it was so much due to Annalise's need that her need was so great before, and I guess it just wasn't recognized or something maybe. And, and part of it, too, I will admit, is some of it was probably my husband and I, our lack of ability to explain that we really needed all this care. It wasn't that we weren't unwilling, but maybe just that we didn't realize that this was unusual, for kids like this in this program, that, really we aren't ever sleeping and, our backs are killing us. And, I did actually break my foot one time, and so we need extra, we needed some extra help, that kind of way. And so as the pain became greater and greater to us as a family, we started, squeaky wheel gets the grease kind of thing. Mm-hmm. So we started vocalizing more. Hey, this is going on. We really need this help. We really need this help, and part of that, too, we're like, we don't ever want to bother someone. But that's what they're there for, just realizing to speak the need, and then we were able to get more and more services and stuff and just saying, even pleading sometimes, will you please ask about this? Would you, because we were kind of at the mercy of the CAPC management group being willing to, or being able to vocalize themselves what the needs were for our family and for Annalise.
Okay. Who decides what home health care your child and family received?
We did. We definitely did. As far as, being able to choose an agency, that was wide open to us, and we changed, we tried not to change too often, just so we could keep nurses that we had, because oftentimes changing agencies meant that your nurses could not go with you. So if your nurse was working for an agency prior and you really liked that nurse, but you didn't really care for the service, the way they responded, that nursing agency responded to needs that you had or something like that. If you needed more nurses or some different hours the current nurse couldn't provide and they weren't providing it, If you changed agencies, then it meant that you were probably going to lose the good nurse that you had. You know? So that was always a challenge, because they usually would have like some sort of non-compete in place that would not allow their nurses to then transfer with their client or with the patient that they were working with. They would have to just stop for usually a period of 2 years before they could pick up the case with you again. So sometimes, though, a couple times, though, we were able to utilize more than one agency at a time to be able to get all the hours covered that we were approved for.
Okay. And then you did talk a little bit a minute ago about how the Medicaid waiver program influenced what types of home health care you had. Could you talk a little bit more about how that process looked and what that looked like for them to decide what kind of services you'd qualify for?
Oh, sure. Yeah. So each year we would have we called it our annual meeting with our CAPC case manager, and she would come to the house with the nurse from that CAPC agency, they would just take a full assessment of everything for Annalise, even just, all of her medications. Is she seeing all the same doctors as she was last year? Have you added any doctors? Have you taken any doctors out of the mix? Has she had any new diagnoses? Has she, has she progressed anyway in certain, in this way, that way, whatever medical condition we were talking about at the time. All of those different things would all kind of factor in. And so depending on those needs and depending on, first and foremost, you couldn't even get into the CAPC program unless I think you had three, whatever they considered major medical conditions going on. So for Annalise, it was her cerebral palsy. It was her feeding tube. She was not able to eat anything by mouth. She was NTO. And her seizure, her epilepsy. So those were all key factors for her, even to begin with. So they wanted to see that those things are still current and still true. And then they would, was there increased need? Was she having more trouble, with certain things? Was she, whatever it might be. And so they would kind of document all those things. And honestly, I would say, I would even suggest for y'all to call like a CAPC management agency in North Carolina and kind of ask them their specific process. They could definitely explain it much better than I can, because I was just sitting on the parent side rather than on their side of the table.
Okay.
So, that might be helpful to your study as well. But yeah, those were some of the things. And so then they would go out, they would request that annual approval, and we would wait maybe about anywhere from 2 to 3 months to hear back about whether or not she was going to be approved for services at all for the next year. Okay. So we never knew from year to year whether or not she would be approved again. And they would change, because Medicaid would often change, and that waiver would change a little bit sometimes from year to year as far as who they would cover, what medical conditions were covered under the waiver. Some of that was even changing in the past couple of years, and we were a little concerned about whether or not she would continue with skilled nursing or not, because she didn't have a trach, that kind of thing.
Okay.
So basically, if you wanted services to continue, you had to give your kid a trach, which we weren't willing to do.
Yeah. Okay.
You didn't need it like that. Anyway, so those were some of the factors.
Okay. How much input do you think you have over what home health care is prescribed and delivered?
I would say we had a pretty decent influence in that. And like I said again, as long as we could communicate it. So being knowledgeable and understanding what each of her doctors were talking about as far as her care, understanding what her care entailed, what our goals were with each of her doctors, all those kind of things. Even with her therapist, like her physical therapist, and what was going on with her IEP and how she was progressing through that, being involved in that process well, and being in communication with the school, since we didn't see her for, 6 hours of the day, when she was at school. Mm-hmm. All of those things, and being knowledgeable of those things helped us then to be able to best communicate what was going on for her care, what her needs were. Keeping notes of all those things, because it's just so hard to keep track of. Staying organized that way helped us to be able to communicate those needs to be able to get the services that she needed. And I'll say, like, I feel like we did a pretty good job with that, but I will say I've got friends who did even such a better job. So it was a lot of communication between even families saying, okay, so you're doing that? How did that come about? You know, and learning how did other families receive a certain service that you feel like, oh, you know, I think my child could benefit from that. Okay. You know, those kind of things.
Okay. Were there ever any home health supports that you wish you could have received but were unable to?
Well, like I said, never being able to receive the speech therapy in our home was one thing that we wished, and even just physical therapy in the home rather than having to go outside to physical therapy. Those were some things that we kind of wished we could have had a little bit more help with. We were in the process of starting to get some quotes. We had to always get, if we wanted to have like a home modification done or something like that, we had to go through a process of getting a series of quotes to have something done. For instance, we were considering having the tub in her bathroom changed into a roll-in shower so that we could just roll her in more easily for baths, and so transfers weren't so hard when she was, you know, wet and slippery after a bath and having to carry her, because she was also getting quite heavy, and we couldn't just fit a Hoyer lift into the bathroom, you know, to transfer her and stuff like that. So it was a lot of lifting and carrying. Otherwise, and which our nurses primarily did, but, you know, they were even getting close to their limit of how heavy she was to be able to safely lift her. So anyway, so we were hoping, you know, to be able to get that process underway, and we never did, just because she ended up passing away before we were able to do that. But it was a huge process, and, you know, it just you know, it's such a slow process too. You know, going through the process, getting quotes can take, you know, even up to a month, and then once you get the quotes, then you have to get it approved through CAPC, and that would take another, just depending on the load at the state level, the nurse at the state level who would have to give the final stamp of approval on it, that could take anywhere from, you know, a month to 3 months. A month is probably way too quick. Probably 2 months to 3 months, you know, that kind of thing. And I will say, like, I have a friend who I was talking with the other day who's been waiting on a piece of equipment for 9 months now. Wow. You know, so it's not, you know, so it's any number of different things that can happen that way that can kind of hinder that. But for the most part, we really had a lot, just over time, you know, we really had a lot of good help from her therapist, especially, her physical therapist especially, to get the right equipment that she needed in our home. And CAPC, you know, was wonderful just to be able to have someone who could field that process for us.
Okay.
But, yeah, so there are just maybe just a couple minor things that we didn't end up being able to have.
Did you ever have any in-home palliative care or hospice at all?
We did. We started that last fall. We finally were able to find it. Honestly, we were in hopes of having palliative care services in our home for a couple years before we were able to actually get it. And that was only because it did not exist in our county. And like I've already said, we are in one of the best counties in North Carolina for receiving any number of services, but pediatric palliative or hospice care did not exist before January of 2017 in our county. Now, we had a wonderful doctor at UNC that was already one of Annalise's doctors, her pulmonologist, and who just happened to be also leading up an effort to develop a palliative care program. First, she developed it within the hospital system between UNC and Duke. And then as time progressed on, she was able to get it set up working with Hospice of Wake County, which is where we're at, which, like I said, began in January of 2017. And so, and she just lapse of mind because she's so busy, and we did not see her super often as one of her regular doctor visits, one of Annalise's doctor visits, but we stayed in communication with her, you know, as needs arose. She was able to connect us with and alert us to the fact that palliative and hospice care was now available in our county. And so we began, so that was in like August or September this year. And so we began working with them, and they were able to get us all set up. So we were all really in a good situation when everything changed for Annalise in December, and she needed that care more succinctly.
Okay.
So. Mm-hmm.
Could you tell us about a time when your child did not receive the home health care services that they were intended to, or the care did not go exactly as planned?
Yeah, I was thinking of a couple situations. One was, which I did briefly refer to earlier, summer of 2017, we did not have, we had our overnight nursing in place, and that stayed in place, but we did not have any nurses who came during the day or during any daytime hours, any of the time while she was awake. So, and that was only because, we had 3 or 4 agencies looking for nurses for us, and they just never were providing us anyone to interview. So we just didn't have, they just didn't have the staff, and we had the need, they didn't have the staff for it.
Okay.
And so we had maybe 2 interviews in that whole time. And I will say we did finally get someone in the door at the end of the summer in August, 2 different nurses. One was a nurse aide and